Hey Hattiesburg, it's Toby Barker. Thank you for joining us today as I'm going to update you on the latest on COVID-19 in our community. As we did so on Monday, we're going to bring up some slides right now with some more in-depth information. If you have specific questions on this briefing or any other COVID-related matter, please type those in the comment bar below and we will be glad to get to them later. So what we'll be talking about today is we're going to give you the basic numbers on what's been going on in our city over the last 3 days. We're going to talk about this idea of what qualifies as a vulnerable population as we talk about one of our two major goals. We're going to talk about shelter in place and what that means going forward. We're going to talk about some CDC guidelines for masks. That was something that we moved on yesterday. And then we're going to profile a couple of things, acts of courage in our community during this pandemic. So when we talk about our numbers, again, keep in mind this. The numbers that we have are system-wide for our healthcare organizations. So Forrest General Hospital has 19 counties. Hattiesburg Clinic serves several. Merit Health Wesley serves 18 counties. And Southeast Mississippi Rural Health Initiative serves several as well. At this point today, and again, these numbers will change later tonight, there have been 2,742 tests for COVID-19 completed in our healthcare system. 212 of those have been positive. Again, that's system-wide for our healthcare organizations. There are 1,643 have been negative, and we have 887 pending tests. And I really want to talk about those pending tests again. We went over this Monday, but we've seen even further moves upward on the number of outstanding tests that are there right now. Just 10 days ago, we had 648 pending tests. That's actually increased to 887. Now, we know that testing capacity has improved around our state and around the country. What that's leading to, however, is that it's harder to get a test processed right now. There's a long waiting line. We had several tests that we know about that were 5 and 6 days getting the result back. And I know that's frustrating, but that's kind of where we're at right now. What we do think will happen over the next several days is we believe that both Forrest General Hospital, Hattiesburg Clinic, and Merit Health Wesley are all working on individual projects to try and make their testing more efficient. So hopefully by this time next week, if we do a briefing a week or even maybe 10 days from now, you're going to see that number of pending tests go down, because what we often see is if there are 887 pending tests out there right now, there's probably 5 to 10% of those are going to test positive. And so getting an answer back on those tests, I know is something that everyone wants, and it gives us a greater idea of kind of where we really are in terms of the numbers. So right now per county, 71 in Forrest County as of this morning. Lamar County had 24. Now, that's a significant jump from 3 days ago. 3 days ago, Forrest County only had 46, so 25 more cases have tested positive. Typically, those are running a day or two behind from the patient actually getting the positive result, going to Jackson and being put on the county's number, which is another item of concern. But we've seen 25 more in Forrest County. We've seen also several more in Lamar County. We also know in Forrest County that we've had 2 deaths, and we'll all, again, that often lags behind a couple of days from when the actual death occurs. So we'll probably see that number go to 3 in the next couple of days as well, as the State Department gets notification of those things. Aside from the total number of cases, when we try to measure kind of where our healthcare system is in dealing with this, we look at hospitalizations, because ultimately hospitalizations and ICU admissions are the clear determining factor on whether our healthcare system is going to be able to meet the demand that's going to come from COVID-19. Right now at Forrest General Hospital and Merit Health Wesley, these are totals for the entire health system. We have 21 patients in the hospital who have tested positive for COVID-19. We have another 45 that are under investigation. That means they are showing some symptoms of cough, fever, trouble breathing, but they have not, they are waiting to get their test back on whether it's going to be positive or negative. But an even bigger factor than just hospitalizations is ICU admissions. These are the most acute patients. These are the most fragile and vulnerable patients. They take a special kind of equipment. They take personnel with specific skill sets. And this is going to be where the rubber meets the road in terms of the health system. And so we have 12 patients in our ICUs combined. That's Forrest General and Merit Health Wesley system-wide that have tested positive for COVID-19. We also have another 10 that are under suspicion and are awaiting test. We have a set number of ICU beds in our city. And the challenge for us is if it was just Forrest and Lamar County, we would, we could meet that demand. But, a part of being the hub is it, a lot of people from around our area use Hattiesburg for their most acute healthcare needs. And so you're going to see our health system be stretched and taxed. We know there's a certain capacity that we have in ICU right now, but both Merit and Forrest General have developed plans to double those if the need arises, and we do believe it will in the next several weeks to a month. So that's ICU admissions. Now we're going to talk about our overall goals. The reason we give you the ICU numbers is because we have two major goals when it comes to all of our efforts regarding the coronavirus. First, we want to protect vulnerable populations, and we'll get to that in a second. But we also want to prevent overrun of the healthcare system by slowing the spread. That's the reason we try to flatten the curve, is if you can space out when people need healthcare, if and when they need that care, there's going to be the resources and the personnel there to take care of them. And that is why we're so worried about hospitalizations and ICU admissions, because we can't have that number escalate too much too quickly. And so, but let's talk about vulnerable populations. Who is vulnerable? First, if you look at CDC guidelines, people who are over the age of 60 are considered vulnerable. This does, while this disease can affect anyone, mainly if someone is over the age of 60 and they contract the coronavirus, they're more likely to have serious issues when it comes to being hospitalized and put in ICU or worse. But we're also seeing, especially in the last few days in Mississippi, people with underlying chronic health conditions, things like asthma, HIV and AIDS, if you have COPD or some other heart condition or lung condition, if you have other immune deficiencies because you're recovering from cancer or you're from some other surgery, if you're obese or have diabetes or kidney or liver disease, you're especially vulnerable when it comes to COVID-19. The truth is, because of how this virus moves, it puts people with chronic health conditions at risk very quickly. In our own community, we have seen reasonably healthy people who are managing their chronic conditions within 1 to 2 weeks have to go to the hospital or the ICU or worse. And that is why it is so important that we protect those most vulnerable by trying to stay in, first of all, and doing all that we can to limit their exposure. Again, as we go into the weekend, we want to remind you that we are under a stay-at-home, shelter-in-place order from Governor Reeves. And the list of what is essential, what is considered essential, and what you can do is very limited. You can go to the grocery store or the pharmacy to pick up your food or medicine for yourself or someone who cannot. You can go to your healthcare appointments if you still have them. You can go to restaurants to pick up takeout. You can go for some reasonable amount of exercise. What we're finding, though, especially in the last week, even though we've been at shelter at home, shelter in place, there's still going to be touch points where people are still at risk of exposure, touch points where they run into people. And that's what's led the CDC and the State Department of Health to put forward some guidelines on masks and to make some recommendations. What they're finding is in certain studies that there are a significant number of people who have COVID-19 but are asymptomatic. That means they don't have cough, they don't have fever, they don't have shortness of breath, and they almost feel normal, but they still have it and they can transmit it to others without even knowing they're doing it. So a person who feels completely well could still have coronavirus and pass it to someone in that vulnerable population that we're trying to protect. They do this through coughing, sneezing, talking. And so in light of all this, the CDC and now our State Department of Health has recommended wearing a cloth face covering in public settings where other social distancing measures either are difficult to maintain or may not be enough, things like the grocery store and the pharmacy. And we're going to talk about that. But the city has taken this guidance and we're trying to, again, tackle those touch points that vulnerable populations may interact with so that if they do have to get out, that they're much less likely to be affected. And so that's why we issued Executive Order 2020-4 yesterday. This puts some requirements on employees in essential businesses and the few non-essential businesses that are still open. It says, hey, if you're working in the same workspace as other employees, you need to wear a mask. And we'll talk about what mask we're talking about in just a second. If you're an employee and you're in the same room as the public, you also need to wear a mask. And this is in addition to all the shelter-in-place orders and the social distancing measures that we're now under. But what we want folks to know is whether it's an employer providing a mask or whether it's an employer allowing you to bring your own mask. We want to work with folks. We're very big believers in being practical. This morning, after we issued the order, I talked to 2 different construction companies who just wanted some guidance on how they can best implement this and be in the spirit of the law and still be able to practice. And so, we talked it through with them. So if a worker is in the truck with another worker, they need to be masked up. If they're working at the same exact job site within 6 feet of each other or somewhere close to each other, they need to go ahead and mask up to protect if one may be asymptomatic and pass it to the other. And so we also know that a workspace in a manufacturing plant is different than a workspace at a bank. And so we encourage business owners or employees, if you're seeking guidance, if you have questions about this executive order, please reach out to us. Email mayor@hattiesburgms.com. You can also reach out to me on Facebook or Twitter or the city's Facebook page. We'll be glad to talk you through that, because this is not about punishing people. It's about empowering employers and businesses to just keep their employees safe and keep the public safe. And so we want to make sure that we do that in a practical way that is flexible, but still accomplishes the spirit of what we're going for. So that was the requirement that we issued last night, but we also issued some really strong recommendations. And that was for the public to wear a mask. But when we talk about what is a mask, we're not talking about the N95 or the surgical mask, even though those are certainly acceptable. When we say mask, we're going back to that CDC minimum definition. It can be a fabric mask. It can be a homemade linen or cloth mask. It can be a dust mask. It can be just a handkerchief or a t-shirt or a bandana or scarf that you're able to tie around your face. But the ultimate goal is that there is a face covering that covers your nose and your mouth and still allows you to breathe. That is the ultimate definition of a mask, is anything that you can cover your nose and mouth with and still comfortably breathe. So the recommendation that we're giving to you this weekend as you go out is, if you go into a public space, if you go to the grocery store, if you go to the pharmacy, if you go to the dollar store or to pick up takeout food, please wear a mask. It's the right thing to do. We really need community leaders. We need influencers who are just willing to wear this out and be a good example, because not only does that normalize it, but it also sets the expectation, hey, I am about something bigger than just me. This is about the community. This is about protecting those most vulnerable. Right now, I am in my office here. I am alone, but when I leave to go out into the main office and out into the hallway, into the elevator and down to my car, I will put on my mask. The truth is that we know what the future holds in our community. We can see the potential worst case scenario by looking at cities in other states. You can look at what's going on in the Northeast and New York right now, and we're trying to prevent that from happening here. So by taking these measures, by taking them serious, by engaging in good personal responsibility, and by businesses helping out on their end, we can prevent that worst case scenario from happening. All right. So a couple things to close out today. We have 2 acts of courage that we want to give shout outs to. First is the series from the Signature magazine called Alive from a Safe Distance. This happened one of the first weekends where COVID started popping up in our community. The Signature magazine, along with Pine Belt News, put on these sort of mini concerts that were broadcast on Facebook to an empty room with musicians that are practicing social distancing, staying apart from each other, but also just sharing their art. It gives also people in Hattiesburg a chance to help tip artists who right now cannot perform for audiences. And we encourage you to go to facebook.com/thesignaturemag to see which show is next. There's some good ones coming up this weekend. Support your artist, but also just enjoy the fact that there's still art out there. There's still things that are beautiful, and we want you to enjoy those. The other thing we want to spotlight today is Forrest General's initiative, Paint the City Red. This is an effort to unite and to thank our healthcare workers, and we hope that you will tie a red ribbon on April 15th. We hope that you'll wear red if you're getting out. But this is a community initiative, and this is happening across the country. We want Hattiesburg to be part of that. So show your support for our healthcare workers by painting the city red. It can be a ribbon on a mailbox, on your house, whatever it takes. April 15th, hashtag HBurg wears red. So today, this weekend, as you go throughout Holy Week, we hope that you have a great Easter weekend. And remember, just a few things. If you see other things that are acts of courage, please reach out to us with the hashtag the Hattiesburg Way. But as we close out, remember to wash your hands. Remember to take care of yourself, wear a mask if you go out in public, and do only what is essential. Most importantly, just stay home. Hope you guys have a great rest of the day. And if I don't see you, have a good weekend.